Hello buddies. Today in this video we will talk about sodium, osmolality, hyponatremia, hypernatremia. Introduction. The sodium level is intimately associated with water balance in the body. Sodium regulates the extracellular fluid volume. Total body sodium is about 4,000 ml equivalent. About 50% of it is in bones, 40% in extracellular fluid, and 10% in soft tissues. Sodium is the major cation of extracellular fluid. Sources: salt, pork, sardines, cheese, green olives, cornbread, potato chips, processed or canned foods. The average intake of table salt is 5 to 15 grams per day. Requirements: 5 grams per day. Functions: responsible for osmolality of plasma. Helps in maintaining the normal distribution of water and osmotic pressure in the ECF compartment. Regulate electrolyte and pH balance of the extracellular compartment to control the electronic potentials of excitable tissue such as nerve and muscle, in the active transport of glucose, galactose, and amino acids across the intestinal mucosa and for Na plus K plus ADPase. Osmolality. Plasma osmolality or osmolarity measures the body's electrolyte-water balance. Osmolality and osmolarity are measures that are technically different, but functionally the same for normal use. Osmolality is a measure of the osmoles of solute per kilogram of solvent, whereas osmolarity is defined as the number of osmoles of solute per liter of solution. Osmolality can be measured on an analytical instrument called an osmometer. Clinical uses: for investigation of hyponatremia, identification of osmolar gap. Urine osmolarity is an important test of renal concentrating ability for identifying disorders of ADH mechanism and identifying causes of hyper or hyponatremia. Hyponatremia refers to lower than normal level of sodium in blood. Causes: occurs because of an imbalance of water and sodium. Occurs when excessive water dilutes the amount of sodium in the body or when not enough total sodium is present in the body. Decrease in plasma sodium may be due to defect in kidneys or adrenal cortex. Sweating, burns, vomiting or diarrhea, which can cause loss of sodium-containing fluids. Normal volume, euvolemic, hyponatremia. The amount of water in the body is normal, but an antidiuretic hormone is being inappropriately secreted from the pituitary gland. This may be seen in patients with pneumonia, small cell lung cancer, bleeding in the brain, or brain tumors. Excess volume, hypervolemic, hyponatremia. Too much total body water dilutes the amount of sodium contained in the body. This can be seen in heart failure, kidney failure, and liver diseases like cirrhosis. 3. Inadequate volume, hypovolemic, hyponatremia. The amount of water in the body is too low as can occur in dehydration. The antidiuretic hormone is stimulated, causing the kidneys to make very concentrated urine. This may be seen with excessive sweating and exercising in a hot environment. It can also occur in patients with excess fluid loss due to vomiting and diarrhea, pancreatitis, and burns. Hypernatremia. Hypernatremia is an electrolyte disturbance with elevated sodium level in the blood. Hypernatremia is generally not caused by an excess of sodium, but rather by a relative deficit of free water in the body. For this reason, hypernatremia is often synonymous with the less precise term, dehydration. Even a small rise in the serum sodium concentration above the normal range results in a strong sensation of thirst, an increase in free water intake, and correction of the abnormality. Therefore, hypernatremia most often occurs in people, such as infants, those with impaired mental status, or the elderly who may have an intact thirst mechanism but are unable to ask for or obtain water. Causes: decreased activity of ADH. Hyperactivity of the adrenal cortex, in Cushing's syndrome. Common causes of hypernatremia include hypovolemic. Inadequate intake of water typically in elderly or otherwise disabled patients who are unable to take in water as their thirst dictates. This is the most common cause of hypernatremia. Excessive losses of water from the urinary tract, which may be caused by glycosuria, or other osmotic diuretics. Water losses are associated with extreme sweating. Euvolemic. Excessive excretion of water from the kidneys caused by diabetes insipidus, which involves either inadequate production of the hormone, vasopressin, from the pituitary gland or impaired responsiveness of the kidneys to vasopressin. Hypervolemic. Intake of a hypertonic fluid. This is relatively uncommon, though it can occur after a vigorous resuscitation where a patient receives a large volume of a concentrated sodium bicarbonate solution. Ingesting seawater also causes hypernatremia because seawater is hypertonic. There are several recorded cases of forced ingestion of concentrated salt solution in exorcism rituals leading to death.